is there.
Yeah, we are live now.
Yeah.
Okay.
Okay, great.
Shall we start, sir?
Yeah, I think if you permit, Dr. Shanoy.
Yeah, go ahead, please.
Yeah. A very good evening to all of you, all the participants and viewers around the state, around the country, I should say. I take this opportunity to introduce myself before we formally begin this program. For the benefit of those of you who do not know me, myself, I am Dr. M. Khalid Ahmed Khan. I am the present secretary of the Indian Pharmaceutical Association Karnataka State Branch. I've taken up this responsibility very recently. Earlier, Dr. Manjunath has been actively performing the responsibilities of the secretary. So also I'm working as the assistant drugs controller in the drug control department of Karnataka. So on this occasion of National Pharmacy Week celebrations, I take this opportunity to welcome all of you and telling you about the pharmacist's role. We all are pharmacists and basically have been very active in the last 8 to 10 months during this COVID period. The National Pharmacy Week celebrations has a very big, very long history. So to say, from 1939, we have been celebrating National Pharmacy Week. And aptly every year, depending on the present situation, the themes are being assigned. And this year's theme is pharmacists, frontline health professionals, very aptly selected by our seniors and the organization members of the Indian Pharmaceutical Association. So the Indian Pharmaceutical Association, the basic aim being a national level professional organization with the basic aim of elevating the image of the pharmacists in the community, at the government level, and at all the stakeholders level, so that the image and the actual work of the responsibilities of the pharmacists are brought to the forefront. The Indian Pharmaceutical Association is having members from various facets of this organization, vast plethora of professional activities like the industry, the drug manufacturing industry, the teaching professions, the regulatory departments, and the community pharmacists, most importantly, are all members of this professional organization. The Indian Pharmaceutical Association, has it has branches in all the states, and every state is actually taking up responsibilities for elevating the image of the profession in the community. So likewise, the Indian Pharmaceutical Association has the Karnataka Pharmaceutical Association branch under the dynamic leadership of Dr. K.R.P. Shanoy as president of the Karnataka State branch, and Dr. Narasimha Reddy as vice president of the state branch, and another vice president, Mr. Amresh Tumbagi, the additional drugs controller for the state of Karnataka, and earlier the secretary, Mr. Manjunath, have been doing a lot of great work in terms of organizing continuous education programs for the community pharmacists, for the hospital pharmacists, and industry professionals as well. So not taking much time, I would like to tell that today's function of the National Pharmacy Week celebrations organized by the Karnataka State branch of the Indian Pharmaceutical Association have requested Dr. T.V. Narayan, the national president of the Indian Pharmaceutical Association, to be the guest speaker for us and enlighten us regarding the activities and throughout the country during this very challenging times of COVID. Today's program, I will just sum up that it will start by the welcome address by our President, Dr. Shanoy. Excuse me. And followed by the introduction of the eminent speaker by Dr. Narasimha Reddy, followed by the speech of the speaker today. After that, we shall have a small open house session, a question hour. Probably, if I get some chats on the screen, I would note down, and probably we can have a discussion at the end of the session, followed by the vote of thanks by Dr. B. Ramesh, who's been a very dynamic joint secretary so far and treasurer now, presently as a treasurer of the Karnataka State Branch. So thank you very much, and I request Dr. K.R.P. Shenoy. Before that, I would like to give a brief introduction to Dr. Shenoy, our president. Dr. Prema Shenoy has been the former director of quality assurance and regulatory and patient safety in AstraZeneca. Right now, he is a consultant to many of the pharmaceutical companies in the area of quality and compliance. He has done his MPharm and PhD. He is an alumni of Government College of Pharmacy. So he has vast experience of 30 years in the area of product development, quality control, analytical research, quality assurance, regulatory affairs, safety, health, and environment, and has experience both in domestic as well as multinational companies. He's been a resource person for seminars and trainings in India and abroad. He's published a book titled Handbook of Pharmaceutical Quality Assurance. It's been a very good informative book. Even I have gone through that. So he is also the member of the editorial board of the Pharma Times. He's the member of the technical committee of OPPI, that's the Organization of Pharmaceutical Producers of India. He's the vice chairman technical committee of the OPPI, and he was also the honorary secretary of the Karnataka Drugs and Pharmaceutical Manufacturers Association of Karnataka. And he's been the president IPA Karnataka branch from 2018 onwards. And at his dynamic leadership, we have been conducting a lot of programs and been actively participating. He's also the member of Regulatory Council India Society for Clinical Research, member of editorial team of Clinical Research Journals, ISCR, and a lot of awards to his credit. And probably I may take a lot of time if I go into the depth of his achievements and all that. It's been synonym to quality control in the professional areas. I request Dr. Shenoy to come forward, please come forward and deliver the welcome address.
Good afternoon to all of you.
Good afternoon.
Thank you, Dr. Khan, for wonderful introduction. At the outset, it's my pleasure and honor to welcome Dr. T.V. Narayana, National President, Indian Pharmaceutical Association, for this 59th National Pharmacy Week celebration organized by Karnataka State Branch. I also welcome all the office bearers of the Karnataka State Branch and all the participants from among the, I think, community pharmacy students and people from the industry and enforcement agency. We all have assembled today to celebrate this 59th National Pharmacy Week. And one of the major goals of organizing this National Pharmacy Week is to make all stakeholders, such as patients, immediate family members of the patients, medical, paramedical professionals, local and state governments, the regulators, policymakers, and very importantly, students and citizens of our country, to make them aware of the role of pharmacists and pharmacists' expertise in the area of medicines, and so on and so forth. But unfortunately, because of this pandemic situation, we have not been able to organize any event for the citizens and patients. We are only organizing some webinars, for students and IPA members. As you appreciate, pharmacists have made a mark in different areas: education, enforcement, community, and industry. In the next maybe just couple of minutes, I will focus on community and industry. Certain situations in our country, such as, for example, irresponsible use of antibiotics and in general other medicines, leading to antimicrobial resistance, has increased the burden of non-communicable diseases among the population. So pharmacists has a very important role to play, especially the community pharmacist, to help the masses in getting over problems related to these areas like antibiotic resistance and so on and so forth. Working towards these areas would be a great help in improving medicines usage and bringing out the overall health outcome for the patients. Globally, pharmacists, they form the third largest human resource after physicians and nurses. We come the third. If you see globally also, if you see the manpower within the healthcare system. But pharmacists are medical experts and provide valuable contribution at various stages in the medicine's life, right from research and development, where a drug is discovered, up to the end, where medicines is made available to the patients. We play a role, at different levels. This is a great contribution which pharmacists are making to the, humans. Coming to community pharmacists, pharmacists can contribute significantly to improve public health. Situations such as increasing disease burden, irresponsible use of medicine, socio-economic conditions, low health literacy in India, they demand increasing and expanding role of the pharmacists for the benefit of the society. So pharmacists provide a wide range of patient-oriented services. Of course, this is very, very much so in most of the developed countries, but in India, this area has to improve considerably. Although some of the pharmacists are playing a key role in providing this type of services to the general public, but there's a huge scope for pharmacists to excel in this area, and to become a part of the overall healthcare system. And coming to the industry, the role played with the industry is huge because we contribute to making a high quality, affordable medicines to the public, not only in India, but also, most parts of the world. And we also believe in sustaining the leadership position in the export of generic products. Because we are the leaders today and we need to maintain that position in the years to come. And we have a vision of even becoming leaders in innovation, where we have a long way to go. Actually, we are yet to put a lot of efforts in innovation. That's mainly because the kind of money that is required to invest in bringing out new medicines, it is huge actually. So none of the companies, a handful of companies have invested in innovation research, but Government of India also is helping invest in government laboratories to do research in the area of innovation. But there's a long way to go. But this is the area which I think the future generation should focus, so that India becomes even leader in bringing out new innovative medicines, to the public. We are in an industry which has a very strong value proposition. Actually, we are responsible for improving the mortality of the people, reducing the morbidity of the people, improving the quality of life, and all this put together actually helps in positive economic impact on the Indian economy. Okay, such a big role the industry has played in the last so many years. Coming specifically to the industry part, we have over 400 API manufacturers, about 9,000 and odd formulation manufacturers, and we are totally self-sufficient in medicines. Hardly a few things are imported and marketed by some multinational companies. Otherwise, most of the things are manufactured in India. And we are poised to reach $100 billion by 2025 actually, if we grow at a double-digit growth rate, which has come down in the recent past. Actually, even this year, a couple of months, the sale has come down because of the pandemic. Although medicines of, some categories have increased, but overall sale has actually come down. But going forward, I'm sure, we will do very well and we'll have double-digit growth, leading to, great opportunity for most of the students, who are coming out of the colleges with the degrees and postgraduate degrees. So we also export to over 200 countries, the products. And in 1819, we touched export of about 20 billion US dollars with a growth of about 30%. And we export, I think our export to the US is the highest actually, compared to most of the countries. Okay. Then we are also making a dent in the area of biotechnology by bringing out biosimilars, because generic business has become like a commodity. There's a lot of competition, price war and all that. So some key companies are now focusing on biosimilars, because that is very difficult to develop. It requires more money to invest. You need at least 100-200 million US dollars to develop a biosimilar and put it in the market. But some selected companies like Biocon or Dr. Reddy's and all that, they have started working on biosimilars, and I'm sure India will become a leader even in the area of biosimilars in the coming years. And we touched sales of about 20 billion in 2019, and if you grow at the same rate, I think we will touch 130 billion by 2025. That is the growth projected for India. Okay. And why India is able to grow as a generic leader and export to all these markets more than 2000 is because of some of the key strengths that the Indian industry has shown over the years. What are these? Well-developed industry with a strong manufacturing base. We have cost competitiveness if you compare to any Europe or American manufacturers. We have very well-established network of labs and R&D infrastructure. Highly trained pool of scientists and professionals. I have to congratulate the colleges who are responsible for bringing out bright students with degree and postgraduate degrees coming out and helping the industry to man the various activities within the industry. So there's a very great opportunity for the students in the coming years, and I'm sure that will as I said earlier, focus even on the innovation area. And I'm hopeful that at least in the next 10 years, Indian companies would come out with some new drug, invention for the first time in the country. Okay, I'm very hopeful of that. With that, I think I will hand over back to Dr. Khan to take it over and continue the session.
Yeah. Thank you very much, Dr. Shenoy, for very, about the professional activities of our pharmacists. So I now request, without wasting much time, in fact, I now request Dr. Narasimha Reddy to kindly introduce Dr. T.V. Narayana to the audience. Dr. Narasimha Reddy.
Yes, sir. Yes, sir. Thank you. Thank you.
Yes, thank you.
So, meanwhile, I request others to mute their mic, please, so that there will not be any disturbance, because somewhere there is a disturbance. Or else I'll ask host to mute all the microphones so that there will not be disturbance. Hello. Yes, sir. Good evening, everybody. So it gives me immense pleasure to be before you to propose the introduction of our today's speaker, Dr. T.V. Narayana, who is our guru, mentor, and philosopher to us. And whatever we are today, that is just because of him. So we are there in the profession as they recognize the people. So it's my pleasure to introduce Dr. T.V. Narayana. Dr. T.V. Narayana is an iconic figure in the field of pharmacy profession, particularly pharmacy education. He is well known in all facets of pharmacy, with a rare blend of academic excellence, entrepreneurship, organizational, management skills, and leadership qualities. And above all, an everlasting enthusiasm to serve the field of pharmacy and especially pharmacy education. Dr. T.V. Narayana completed his B.Pharm, M.Pharm from Andhra University and his M.Phil and PhD from Acharya Nagarjuna University, India. He was a state and national merit scholarship holder and the winner of Sri B.V. Patel Trust Memorial Scholarship for securing first seat in B.Pharma in prestigious Andhra University in the year 1980. He is having more than 30 years of rich experience in the field of teaching, research, administration, and is currently working as director of Vikas Institute of Pharmaceutical Sciences, Rajahmundry. It is his own institute and one of the state-of-the-art institutions in India, because I visited many times. Dr. T.V. Narayana, elected unanimously unopposed as National President of Indian Pharmaceutical Association, the prestigious IPA, as we all know very well, from the term 2018 to 20, and elected unanimously as General Secretary of Indian Pharmaceutical Congress Association, IPCA, from 2019 to 2022 for the consecutive third term. He is also nominated as Board of Directors of Asian Association of Schools of Pharmacy in 2019. He is elected as President of Seer Pharma Forum, Southeast Asian Region FIP WHO Forum. He is the he is the first Indian to achieve this position. He is member of DTAB, Ministry of Health and Family Welfare, Government of India. He played major role in bringing the prestigious FIP World Congress in 2011, which was held at Hyderabad, and also 61st IPSF Students World Congress 2015 to India for the first time, and played major role in organizing the several congresses, conventions, workshops, seminars at various capacity to teachers and students and pharma professionals successfully. He has organized the 68th IPC 2016 at Vishakhapatnam as LOC Secretary and reached 10,000 delegateship first time in the Vizag. Core committee member of FIP 2011 World Pharmacy Congress at Hyderabad, Joint Secretary of the 63rd IPC Bangalore 2011, LVC Secretary of 5th IPA Annual Convention Bangalore, and LOC Secretary of the 17th APTI Annual Convention at Rajahmundry 2014, 9th and 10th IPA Students Congress at Rajahmundry in 2017 and 18. During his unstinted association with pharmacy education, he played a key role in the development of the IPA education divisional activities throughout India and contributed immensely to the phenomenal growth and expansion of IPA by mobilizing more than 1,000 life members and 2,000 student life members. And Dr. T.V. Narayana was instrumental in the establishment of IPA AP State Branch, IPA local branches at various places throughout India. During his tenure, IPASF student chapter were established at various colleges throughout the country and guided them to bag prestigious were established at various colleges throughout the country and guided them to bag prestigious Sidney J. Rolfe Award for the Best Pharmacy Students Association of the World and the Vampire Cup Award. He has organized 4 international conventions, 21 national workshops, 10 student congresses, and more than 100 seminars in various places throughout the country. He has participated in more than 100 conferences as a resource person and chaired more than 50 scientific sessions at national level and 12 sessions at international level. With his unquenched passion in the field of pharmacy, Dr. Narayana has attended many conferences held at both national and international levels and presented scientific papers at various conferences of WHO, FIP, FAPA, AASP, held at Amsterdam, Portugal, Turkey, Australia, Switzerland, China, Philippines, Japan, Egypt, South Korea, Thailand, and Dubai. That is recently in Abu Dhabi. We all were there. He officially presented the IPA in Academic Pharmacy Section meeting and Global Pharma Education Task Force meetings held at Beijing, Portugal, Istanbul, and Nanjing. Dr. Narayana relentlessly efforts in the field of pharmacy education have brought him several accolades and laurels, making him the national choice for many awards and honors. He has received the prestigious IPA Eminent Pharmacist Award in the year 2016 and IPA Fellowship in 2005, Fellowship of Association of Biotechnology and Pharmacy in 2008, Paul Harris Fellowship, Sirimuva Award in 2010, Shikshaka Bhushan Award in 2009, Best Alumni of AU in 2006. There are so many. I think they will not be enough to read all these things. Sir, I wholeheartedly, on behalf of IPA Karnataka State Branch and all the office bearers and those who are listening and participating in this webinar. I wholeheartedly welcome you, sir. Thank you. Mr. Khan?
Yeah, thank you.
Up to you, sir.
Thank you, Dr. Narasimha Reddy, for a very brief, I should say,
Yes, sir. It is very brief.
considering his achievements in this profession.
Yeah, I have taken some highlights of the from the
Absolutely.
profile.
Absolutely.
Yes, sir.
But I think we should give him more time so that he will interact directly with the audience
That's why I reduced it, sir.
who are really impatient to listen to him.
Even more.
I welcome Dr. TV Narayana. Please, sir.
Thank you, Dr. Narasimha Reddy, for the brief introduction and nice introduction. First of all, my compliments to Dynamic President Dr. K.R.P. Shenoy, IPA Karnataka State Branch, and Dynamic Secretary Mohammad Khalil Khan, and Vice President Narasimha Reddy, Treasurer Dr. B. Ramesh, for coming out this NPW 2020 celebrations. And I'm happy to see very senior teachers through this webinar. And my compliments to IPA Karnataka State Branch for organizing this 59th National Pharmacy Week celebration. And Karnataka is always in the forefront in the area of IPA and activities. It's the most vibrant organization. It is the first state branch to procure its own building in the state of Karnataka, that in Bangalore. And thanks to all the leaders who contributed from the state of Karnataka for the development of IPA, thereby contributing for the development of pharmacy profession. That's what I want to convey on my behalf. And greetings from my behalf and on behalf of IPA Center to all the members participating in this webinar. And coming to this National Pharmacy Week, and I proudly say, 1 minute, I will go to the share screen then.
So your voice also slightly, it is, low.
Okay.
You can adjust that.
Yeah.
Microphone దగ్గర పెట్టుకోండి సార్.
Yeah, I will do it. Yeah, now is the screen visible?
Yes, sir. It is visible.
Okay.
Yes, sir. Slideshow చేయండి సార్. Slideshow.
Slideshow.
కింద ఉంటుంది సార్.
Down, huh? No, F5 I can go, Yeah.
Yes.
Coming to this 59th National Pharmacy Week, just I will brief a few about IPA and what are the achievements IPA has done. Then I will come to the NPW celebrations. Already briefed initially by the Dr. Khanji. IPA is a national professional body of pharmacists engaged in various facets of profession of pharmacy. If you take the history of IPA, it was established in the year 1935 as UPPA, that is United Provincial Pharmaceutical Association, by Father of Pharmacy, Sri M.L. Shroff. And in the year 1931, the UPPA name was changed to IPA. So it is before independence, the organization started and having 80 plus years of history when compared with any professional organization in our country. And at the same time, IJP, that time, today it's called as Indian Journal of Pharmaceutical Sciences. The Indian Journal of Pharmacy was started in 39. And the official magazine of Pharma Times started in the year 1963. The headquarters of IPA was shifted from BHU to Mumbai on 1st January 1953. We have 22 state branches and around 56 local branches with more than 15,000 strong membership and vibrant organization with professional activities. And IPA, along with other activities, started National Pharmacy Week from the year 1962. It is not from 1939, it is from 1962. So more information will be given in the website www.ipapharma.org. The vision and mission is to promote the highest professional and ethical standards of pharmacy, to project the image of pharmacist as competent healthcare professional, to represent government and other agencies on various professional and vital issues. That is the main aim of IPA. And IPA is affiliated with international associations like FIP, that is Federation of International Pharmacists, FAPA, Federation of Asian Pharmacist Association, Commonwealth Pharmacist Association, AAPS, IPSF, WHO, Seer Farm Forum, AIPS, all these international affiliations IPA is having. This is the team IPA for the term 1820, and due to COVID-19 pandemic, the Central Executive Committee in its not central, the IPA general body and a special general body meeting, they extended the term up to 2022. We have 6 divisions, industry pharmacy division, each division headed by one person. Industry pharmacy division headed by Mr. Jayshalan from Tamil Nadu. Education division headed by Dr. Vijadra from Andhra Pradesh. Regulatory affairs division headed by Dr. Subhash Mandal from West Bengal. Community pharmacy division headed by Mrs. Manjari Garat from Maharashtra. Hospital pharmacy division headed by Dr. R.N. Gupta from Jharkhand. And in addition to these divisions, we started students forum that is being headed by Dr. Pragnayalla. These are some of the flagship activities of Indian Pharmaceutical Association. We organize national electrician competition every year. The competition right from the main aim of this is to bring the hidden talent of the students from institutional level. We conduct at state level and semi-final level and final level. And final level, we are giving all the facilities like accommodation and registration to attend the IPC, where the second day the NEC is being conducted, and travel assistance also we are providing. In addition to this, placement assistance we are giving to these winners of this national electrician competition. And national pharma quiz and national GPAT mock test started by education division. That is the last 2 years he is organizing this wonderful activity, and excellent response we are getting from these two flagship events. And NPW, that is one of the activity. And IPA is proud to say we are the only organization providing IPA IRF scholarship for poor and needy. Around 40 lakh scholarships we are providing to 160 students throughout the country. 40 institutions were selected throughout the country. And from each student, first year, second year, third year, final year, B Pharma student, whoever recommended by the principal and who is the poor and needy, we are providing. Thanks to Pankaj Patel, the MD of Jydus Cadila, who has instituted this scholarship. IPA also provides travel grant to the teachers and students whose scientific abstracts were accepted to present at either national level or international level. This is to encourage the research. IPA is providing this travel grant. IPA ACG Innovation Awards. This was again instituted by Associated Capsule Groups, thanks to Mr. Ajit Singh. For the past 5 years, we are giving this award to the best innovations in solid dosage form and the best innovations in packaging. And this is not only for the industry, even for our teachers also can participate, and researchers, students also can participate. 1 lakh is the prize money for these 2 awards, IPA ACG awards. IPA honor the persons who served the profession of pharmacy and IPA with various awards like IPA Eminent Pharmacist Award, IPA ML Corona Memorial Lecture Award, IPA Fellowship Award, and even we recognize the best state and local branch award with various activity. I am happy to share Karnataka almost 3 times they bagged the best state branch award, and we honor IPA Lifetime Achievement Award, And for researchers and teachers, IPA, IJPS Best Research Paper Award also at various category we are giving every year. These are our the prestigious publications of Indian Journal of Pharmaceutical Sciences and Pharma Times. Even during this COVID-19 time, we have come with e-magazine of Pharma Times. The first issue was dedicated to great teacher from India, Professor Harkishan Singh. In addition to these honors, last year we recently introduced IPA Industry Excellence Award. Uh, IPA felt that we are moving away from industry when compared with the yesterday years. So we thought to introduce this award and honor the industry excellence. And we are again happy to share with, I am again happy to share with you two gigantic personalities, two giants from pharmacy. One is Pankaj Patel from JDS Kadala, another one is Krishna Yalla from Bharat Biotech, were identified and honored with Industry Excellence Award 2019 and December at Chennai. These two, everybody knows they are in the front runners for this COVID-19 vaccine today. IPA organizes conferences, conventions, seminars, workshops. These are some of the glimpses what I want to share with you people. And IPA participation at various levels. Wherever the conferences were organized, IPA was there as a official partner, or IPA state branches and local branches organized various activities. This is participation in FIP, World Pharmacy Congress, and CR Farm Forum meetings. This participation in Asian Association of Schools of Pharmacy meetings and international conferences. This is participation in Federation of Asian Pharmacists Association. And this is regarding the participation in national TV channels and media. Earlier, IPA was never approached or asked to participate in the TV channel for any debate or anything. But we are fortunate this year on 25th of March and 28th of March, I was invited by the national TV channel in the urban debate where we participated about the role of pharmacist and about the supply chain management, all. That is the gives me a bit of satisfaction. We were recognized by the national TV channels, at least now after serving this profession for past 80 years. These are some of the glimpses where we were involved and we have given the press statements, and it was there in India Today, Mirror Health, and so many journals also came forward and took the interview about the role of pharmacists during this COVID-19 pandemic. These are some of the activities we organized during this COVID-19 pandemic. I think it may be record by any single organization organizing so many webinars that record will goes to IPA. And even some of the branches, they distributed food during the lockdown to the truck drivers and migrant workers. This is one of the major contribution. And more than 2 crores worth of medicines were distributed by IPA Tamil Nadu state branch. Immense contribution by IPA state branches and local branches. And this was the prestigious project of IPA, that is the building. With the photograph was taken in the month of March. Now the plastering, everything is ready. I could not get the latest photo. Uh, One of the biggest building of any professional organization in India. This is the long dream project, and the building is ready mostly by March or April 2021. We are planning to inaugurate this building. Thanks to all the donors, all the members, all the contributors, all the industry personnel, all the institutions who voluntarily contributed donations for the construction of this building. This is what I want to uh, bring it to the notice of all our members. One of the prestigious project of IPA came true. That is the long dream of IPA came true. All these activities made IPA to get bagged Best Professional Association Award in 2015 at Indian Association Congress. And all these activities, I will not say these 2 years, but last 4, 6 years, IPA is more visible and more vibrant at not only at national level, but at international level also. Some of the examples, Dr. Rao Adlamudi, my immediate past president, who got elected as president of Commonwealth Pharmacist Association, representing around 24 countries as the members. Myself, I was elected as the president of CR Farm Forum, Southeast Asian Regional Farm Forum. Recently, Mrs. Manjari Garat got elected as a Vice President of uh, FIP, Federation of International Pharmacists. That is the highest post of any pharmacist in world. And I myself, we got, I got FIP, FAPA issue date award in education category. And last year, Manjari Garat got in community pharmacy category. Before that, Subodh Priyalkar got in industry category. So these are some of the examples. IPA is more visible and vibrant, not only at national level, but at international level with various activity we are organizing. Coming to the some of the students' activities, because I was told that so many students are attending this program, so I thought let me give some glimpses of what our IPA students are doing and what are the advantages of being a member of IPA. That's what I want to brief on this occasion. We have so many programs, student exchange program, blood donation camp, health awareness program, TB fact card project. And recently they have come out with a sign languages project where this project will help the physically challenged people of up and down. This is student exchange program. The students from other countries, they will come to India because they were not experts in the manufacturing areas. They will come and train themselves in the manufacturing area with the facility what we have. Equal number of students we can send to their country where our students will be trained in practice-oriented area. This is the student exchange program. Any students who are interested to go to developed country and learn something in the practice-oriented areas, they can opt through the student exchange program. This is the leadership in training program. This is again one of the flagship activity of Indian Pharmaceutical Association. And if you see all the office bearers of Students Forum, they are in top position now. So it gives us immense satisfaction. We are preparing the future leaders. We are giving the future leaders to the profession of pharmacy. I have come across with several Students Forum leaders, those who are well settled. They are in very good position, leading position of the profession. These are some of the activities organized by Students Forum during this COVID-19. They have taken the webinars from all the top personalities, President of PCA, President of Commonwealth Pharmacist Association, Vice President of FIP, and also Treasurer of Royal Pharmaceutical Society, Great Britain. So many activities they organized on their own during this COVID-19 pandemic. And the students have come out with awareness posters about of the pharmacy. Around 8 lakh posters were distributed throughout India. Again, a project of Pfizer. And this is the immense contribution of our students, where we observed a lot of potential in the students. They, they are coming out and contributing. If you take this National Pharmacy Week activity guide, though Manjari Garat was the in charge, majority, most of the material has been prepared by the students. Thanks to the Students Forum for their active participation and involvement in this pharmacy profession. This is the first batch of the Students Forum. Uh, Initially, they started with 40 students. Now it is more than 4,000 students there in the Students Forum organizing the activity. The first Students Forum was inaugurated on 16th of August 2008 by His Excellency Dr. APJ Abdul Kalam. The IPA Students Forum team, we have deputed the team to attend the World Congress at Portugal. More than 9 students were permitted to go there, and their entire travel expenses and total expenses are taken care by the IPA. So with the aim, yes, we are spending this for our future leaders of the profession. These students attended the IPA World IPSF World Congress at Portugal and brought the IPA Students Forum World Congress to India in 2015. This is the first student congress. That time, Dr. Suresh is the president of IPA. The second student congress organized at Bangalore in Acharya College. The third congress, fourth, like this, we organized so far 11 student congress. Recent student congress was held at Visakhapatnam. During this congress, we are not hiring any artist for the cultural program. The students themselves, they are coming forward and participating and giving this cultural program. Huge amount of prize money of 1 lakh we kept for participating in this cultural program, and the best cultural programs were awarded with the good prize money. And this is the team of 61st International Pharmaceutical Students Federation World Congress Indian team who organized at Hyderabad in a bigger way, and it is the highly successful event of the Students Forum. These are some of the achievements. They have bagged the Best Innovative Health Campaigning Award, Best Student Organization of the World Award, Best and Highest Blood Donation Award for continuous 3 years. And these are the some of the achievements of our IPA students. We established the student chapter. The student chairperson is Pragnayala. You can contact either mail and phone, and it was there available on the IPA website also. And recently, we have established nearly 10 student chapter in this COVID-19 period. Total has gone up to 60 student chapter throughout the country, and students are doing wonderful activities through these student chapters. Coming to the journey of pharmacy profession in India, how the journey was started. The education system, if you take the ancient period, we used to have a Gurukul concept, used to train the students without any technology, and used to identify the talent of the student. The same coaching was not given to all the students. The guru used to identify the talent. That's how he used to train a special training to that particular student in that particular area, which was lagging nowadays. Nowadays, our teachers, we are giving the equal training to all the students. We don't know what are the strengths of the student, what are the weaknesses of the student, whether he is able to understand or not. That's why I proudly say our education system is the best in world, no doubt in it. But we left the original traditional system and trying to catch something, and we are failure in that particular aspect. And I come across with several teachers and students or professionals. Everybody say we are way backward, we are developing. What developing? We are recently we started pharmacy. If you take the history, the first pharmacy college of the world was established in 1821, Philadelphia University. If you take Indian scenario, the first pharmacy college was established in 1842, maybe by Portuguese. It was in Goa. Now, present Goa College of Pharmacy is the first pharmacy college established in India in 1842. Within 20 years or 2 decades, we also started the pharmacy, but we are nowhere lagging behind or we are nowhere backward. But our efforts are backward, and that is the reason we are not catching up the developed countries. The present Goa College, that time, Escola Medica di Goa, the medicine and pharmacy clubbed together, and then they used to train the students during those days. And coming to the pharmacy education, B.V. Patel, who started in 1932 the BSc program in Banaras Hindu University, later B.Pharm program in 1939, and later several government and private institutions started the pharmacy program. What is the pharmacy education scenario? These are the types of the pharmacy education we are offering in India. D.Pharm, B.Pharm, PharmD, M.Pharm, and PhD. But D.Pharm, B.Pharm, and PharmD are the registrable qualification as per Pharmacy Act 1948. These are the regulations governed our profession. And recently, the Education Regulations 2011 came into picture. And earlier, we have only Education Regulation 91. Again, thanks to Dr. B. Suresh, who brought the reforms in the regulations, right from PharmD regulations in 2008 to B.Pharm regulations, M.Pharm regulations, B.Pharm practice regulations, Pharmacy teachers regulations in 2014, and Pharmacy practice regulation 2015. And that is about the education scenario and about the industry scenario. The earliest traditional system of medicine practiced in India is Ayurveda and Siddha. The colonial period brought the new Western system of medicine and paved the way to emerge pharmacy houses in India. That time, the medicines were imported from the developed countries and they used to sell at 5 folds, 10 folds. That's why a common man is not able to afford the medicine during those days. That is a costly affair those days. Again, coming to pharma industry perspective, the first pharma industry of the world is became in 1859, the first tablet manufactured here. Though Merck has come out with extraction of alkaloids before this, but the first pharma industry was became. At the same time in India, the first pharma industry is Bengal Chemical and Pharmaceutical Works, established in 1892. Within the 3 decades, even our industry also established. Now it was called as Bengal Chemicals and Pharmaceuticals Limited, and it was run by government of West Bengal. And recently, these this company has supplied hydroxychloroquine in batch in maximum bulk to US also. It was established by Sri Praful Chandra Roy at Calcutta. Even our government of India honored him with the by releasing the postal stamp in his name. This was we are not. I am telling we are not lagging behind. We are not backward, but our efforts are not up to the mark to catch up the developed country. For thousands of years, people relied on medicinal properties of plants, animals, and minerals for the treatment. The 19th century is the beginning of the modern era of pharmaceutical industry because it started focusing on chemical synthesis. All these drugs manufactured by chemical synthesis started coming into market from 19th century. But 20th century marks the unification of chemistry and physiology, which increased the understanding of basic drug discovery process. The exact drug discovery process started in from 20th century, mixing chemistry and physiology. If you take paracetamol, ibuprofen developed in 1956 and 60, the contraceptive pill introduced in 60, diazepam, MAO, amino oxidase inhibitor, class of antidepressants, and antipsychotic haloperidol introduced in 63. Insulin was introduced in 1970. The 70s provided a wave of cancer drugs. Angiotensin converting enzyme AC inhibitor introduced in 75 for cardiac health. 70 is the shift began in pharmacy industry, pharma industry. First blockbuster drug, that is Tagamet, ulcer medication, which brought the Nobel Prize with $1 billion of business. That was the shift began in pharma industry. This marked a new departure as company completed to be the developer of the next blockbuster molecule, and many achieved great success. But coming to Indian scenario, we may say we are number 3 in the world and in terms of volume and 14 in terms of value. Till today, we have not produced a single new chemical entity because to come out with a new chemical entity, it takes 12 years plus research and more than 2 to 3 or $4 billion of expenditure, which is highly expensive. That too, we are not investing on R&D. Compared with the developed country, our R&D investment is very less. After becoming part and parcel of GATT and TRIPS agreement forced us to come out with our own R&D. Now every company started investing in R&D. Earlier our R&D investment is hardly 2%. Now I think more than 10% our MNCs started investing in R&D. But we excelled with our reverse engineering skills. Whatever the patenting drug we used to manufacture with the reverse engineering skills, that's how we captured the market of pharma industry of the world. So though we were called as India is the pharmacy of the world, but still we are lagging in coming out with a blockbuster molecule or a new chemical entity. This is our Indian scenario, our Indian pharma industry called as pharmacy of the world. We are proud to say we supply 50% of global demand of various vaccines. 40% of generic demand in US were supplied by Indian companies. 25% of all medicines in UK supplied by our Indian companies. And more than 150 countries we are supplying vaccines, and more than 200 countries we are exporting medicines. Over 80% of antiretroviral drugs used globally to combat AIDS are manufactured by Indian companies. This is the present position, 3rd by volume, 14th by value. And these are some of the achievements of our Indian pharma industry. And thanks to all the pharma leaders, pharma industry leaders, who made India proud by whenever we go abroad, whenever we say we are from India, oh, India, the pharmacy of the world. That was the tagline. We got it because of the contribution of this industry experts and industry leaders. I salute all these industry leaders on behalf of Indian Pharmaceutical Association. Coming to the National Pharmacy Week 2020. It was started in the year 1962. And continuously from that time, we are organizing, IPA is organizing NPW. Every year, they will come out with a theme. 1962, the first NPW has come out with a theme, pharmacy as a career. Again, salute to the leaders of that time. Those who want to promote the pharmacy profession, they have come out with a theme, pharmacy as a career. And that time, the team is ML Khurana is the president, past president is Raptakas, and the secretary is Father of Pharmacy Education, B.V. Patel, J.N. Banerjee, Mehta, Ram Sarma, they are the executive committee members. I salute all those leaders who started or initiated celebration of this NPW to promote the profession of pharmacy in our country and to project the image of pharmacist as a expert of medicine. This was organized during third week of November every year with a specific theme. The 59th NPW theme is being pharmacist frontline health professional. Thanks to Manjari Garat, who is in charge for this NPW celebrations. She has come out with the NPW activity guide. Wonderful information has been given in the activity guide to all the state branches, what to do, what not to do, what is the areas we have to touch, how we have to promote, and what are the, she has provided even pamphlets, leaflets, and all the brochures, everything. And thanks to Manjari and her team for coming with wonderful NPW activity guide. On this COVID-19 pandemic, I think everybody for the last 8 months from March onwards, we are witnessing what COVID-19, what are the changes it made. But when you observe these 8 months, when I observed on my behalf personally, when I observed on behalf of professional friends, it brought some sort of feeling proud. The pharmacy services rendered by the pharmacist at various capacities. It made me and all of us to feel proud that the services rendered by pharmacists are immense during this pandemic period, either at R&D level or at industry front or at regulators, community pharmacy, hospital pharmacies, and teachers. And pharma industry, around 2 lakh pharmacists are working in industry. They started working from the day one of lockdown. And manufacturing the drugs, though the supply of API has been stopped due to this lockdown and bilateral relationship of our Indian government and China government, they manufactured the drugs without short supply of medicine to the entire country. That is the immense contribution of the industry. And regulators, around 550 CDSCO and around 1,500 plus state regulators, they started working from the day one of the lockdown, and they have seen that there is no short supply of essential medicines, no short supply of life-saving drugs, no short supply of drugs for non-communicable diseases. That is the immense contribution of the regulators. Hats off to the industry personnel and regulators. And the hospital pharmacists, around 50,000 pharmacists, they are serving and served in various hospitals, railway hospitals, PHC, government hospitals, and even some in COVID-19 hospitals. Community pharmacists, around 9 lakh pharmacists throughout our country. Again, they started from day one of the COVID-19 by opening the shops 24/7. And even they supplied the drugs to the geriatric people at the doorstep and avoiding the senior citizens to exposure to the exposure of this COVID-19. Excellent contribution by our community pharmacists also. Teachers, again, salute to the pharma teachers. I proudly say pharmacy profession teachers are the first one to come out with online classes and highest number when compared with any other professional. More than 65,000 teachers, though the pharmacy teachers were not trained with the technology, not trained with the latest developments of technology, they equipped themselves, they trained themselves, they started taking classes, online classes. Even some areas they have conducted online examinations. In some places they have completed online convocation also. Again, thanks to all the stakeholders, either industrial personnel, or regulator, hospital pharmacy, community pharmacy, and teachers for the services what they have rendered during this COVID-19 pandemic. And if you take the numbers, many people say 6 lakhs doctors are working, 8 lakhs nurses are working, police personnel, officers, bureaucrats, and sanitary workers. But we are the highest number of any compared with any other healthcare professionals. More
ಕೈ
than
ಹಂಗೆ ತಳಿಸ್ಬಿಡಿ.
12 lakh pharmacists we served during this COVID-19 and still serving this COVID-19. That's what I want to say proudly. And during this pandemic, around 100 plus died. Even I know them personally. The number may be more. Several people whom I know, even from Bengal, the pharmacists, while discharging their duties, they were exposed and they died. And more than 5,000 exposed in serving the society. I, on behalf of IPA, salute the sacrifices made by our heroes. This was a bit of appreciation, though no political leader has recognized the services of pharmacists. When we approached all the government, central government officials and health department and health ministry, at least we got some sort of appreciation from Sri Nitin Gadkari, who is the minister for MSME. Pharmacists are the backbone of our medical support in the war against COVID-19. Their ongoing efforts and success, selfless dedication are saving the lives of people each and every day. I thank them for their invaluable services to the country. This was the wonderful message given by Nitin Gadkari. If you take the statistical data and what are the services, what contribution we have given to the society. The COVID-19 pandemic, when I have gone through the website, the total deaths due to COVID-19 till today is around 1.4 lakh. That means past 8 months. If you take the average deaths due to non-communicable diseases, it is 2.5 lakh per year. If the drugs for non-communicable diseases, that is hypertension, diabetes, respiratory disease, COPD, coronary obstructive pulmonary disorder, anxiety, if the drugs for these NCDs are not available, the number of deaths may be more rather than the deaths due to COVID-19. This was the immense contribution, major contribution of pharmacists to the society. That's what I want to say on this platform. If you take the statistical data, during the lockdown, many hospitals, they stopped the hospitalization unless a major surgery or severe ailments. And the average number of deaths and hospitalization is reduced during this COVID-19 pandemic. If you take the statistical data, why? The maximum deaths occurring in hospitals are due to medication errors. It was a WHO report. 40% of deaths are occurring due to medication errors. Intervention of pharmacists reduced the medication errors by 25%. This is the data of the WHO. During this COVID-19 pandemic, unless there is a severe ailment or major surgery, the patient used to approach the pharmacist, and the pharmacist used to advise the patient what medication to take. This reduced the number of deaths, what I can proudly say. And one more thing, earlier, hardly the pharmacists are visible in the medical shops or pharmacies. Thanks to the regulators again, before this COVID-19, almost around they made them to be available in the shops up to 70 to 80%. But this COVID-19, almost 100% pharmacists are present in the pharmacies because they are getting very good business. They're able to reach the society. The patients are coming to them and asking them what drug we have to take. Some sort of respect is started gaining during this COVID-19 pandemic. That made the pharmacist to sit in the pharmacy. That's what is a good sign, good development for the profession of community pharmacy, particularly in our country. And another WHO report says 1 in 4 patients is harmed by the care they receive in primary and ambulatory care settings, including harm from the medicines. It was estimated that global cost associated with medication errors is around $42 billion per year. And Shanai rightly pointed out in his address, irresponsible use of medicines. Because of this, the medicine wastage is around $700 billion per year globally. This was discussed on big platform in FIP Congress in Amsterdam in the year 2016, and Amsterdam Declaration has come out how to curtail this medicine waste of $700 billion occurring globally. And I am happy to say IPA is part and parcel of that IPA Amsterdam Declaration, where I was signed as a representative of IPA. These facts, all these facts clearly defined the role of pharmacists to play in future. That's what I want to say. And WHO identified 10 current threats to global health of future. These are the 10 global threats of health due to air pollution, climatic changes, influenza, antimicrobial resistance, non-communicable diseases. The NCD collectively responsible for deaths of 42 million per year. 85% premature deaths are occurring at the age of 30 to 50 years and more in low and middle income countries. The risk factors associated with the 10 global threats are pollution, physical inactivity, unhealthy diet, and tobacco, alcohol, etc., etc. This COVID-19 pandemic proved our strength, and society started recognizing the services rendered by the pharmacist, the blessing in disguise for our profession, what we can say. Earlier, nobody used to recognize what is pharmacist. They used to consider as a trade. Now everybody realized the importance of pharma industry, regulator, hospital pharmacist, and community pharmacy. We have a lot many roles to play in post-pandemic also. Not only this pandemic and pre-pandemic, post-pandemic, how pharmacists would be needed more than ever to prevent ill health and ensure patient safety in post-pandemic. The burden of diseases, those existed before COVID-19, that is NCD, remains, and some are likely to be worsened because of the socio-economic problem. This is one of the major effect of this COVID-19 pandemic, socio-economic problems that may be influence the patients to purchase their drugs for the non-communicable disease in future. That's where we, the pharmacists, have a lot of role to play in future. Through this NPW, we all should create awareness about our profession to the society, promote the profession and image of pharmacist as a competent healthcare professional. We have to give solid impact to the society, policymakers, and all stakeholders by raising our voice and see to reach the government till qualified pharmacists are involved wherever drugs are involved. Qualified pharmacists should be involved wherever the drugs are involved, either at R&D or manufacturing or storage or distribution, dispensing. This is what we have to raise our voice. And we have to, all this IPA, state branch, local branch, all the institutions, we have to provide pharmaceutical care, this some sort of training to our pharmacists, and play a crucial role in promoting safe and quality health care and contribute to the society where everyone benefits from access to safe, effective, quality, and affordable medicines. These are some of the wonderful statements given by FIP, WHO in Glasgow 2018 and Abu Dhabi 2019, encouraging for the pharmacists. In Glasgow, they have given a statement by 2030, there was a requirement of 30 million pharmacists to the global workforce. There was a requirement of 30 million workforce. And they have come out with a statement, there is no healthcare without workforce, and there is no workforce without education. That's how the pharmacy education is going to be crucial, how we are going to be contribute to the workforce in future. And also another wonderful statement given during the FIP Abu Dhabi, Glasgow, 21st century will be the century of pharmacists. All the pharmacists and pharmaceutical scientists and educators have a key role in the evolution of the profession around the world. The new technologies are what really promise a positive future for the industry in 21st century. Pharma industry is shifting more towards digitized, customized, and personalized. The individualized treatment is going to be offer better outcome. That's what expert says. The routine business, what we are doing is not enough to prove yourself in the future. The pharmacy should equip with most advanced areas going to come, that is digitized, customized, and personalized and individualized. Emergence of genomics, proteomics going to change the concept of drug delivery. Expert already started telling no one drugs fits all. The healthcare paradigm may shift towards personalized medicines with gene therapy. The same drug, the ibuprofen 400 mg for one person may not fit into the other person. It is going to act based on the gene therapy or personalized medicine in future. New technologies and advancements in science and technology going to change the role of pharmacist in future. Through NPW with various activities, we have to train our pharmacists in clinical expertise. Our pharmacists in community pharmacy are mostly diploma in pharmacy. The same year 91, good old syllabus, the syllabus was not updated to suit the present needs. There is no proper training to suit the need because the syllabus was not updated. Now the new regulations has come out, at least it may serve the purpose to suit the needs of present. Earlier the training is, what training we have given to the students, either diploma or degree. The training is to know more and more about less and less until they know everything about nothing. That's what, on later way, I have given this quote. That was the training we are giving it to our students. We have to train the pharmacists to upgrade and equip with the latest developments to provide value-added services. Present pharmacists are not giving any value-added services which was seen in developed countries. Immunization. More than 75 countries, the pharmacists were involved in national immunization program. Whereas in India, we are not involved in that program. Again, another one good news I want to share on this platform. IPA has given a representation to FIP, where the FIP is providing online vaccination training program to more than 75 countries. Already they started. So vaccine is going to come by December or January or February in India. Once the vaccine comes, we have to give it to more than 130 crores population. Where is the workforce? So we thought, IPA thought, this is the best opportunity for pharmacists to train ourselves in vaccination and make available ourselves to the government. Yes, pharmacist is available, where the role and image of pharmacist will increase in the society. Even society also recognize, yes, pharmacists are giving vaccination. That's what we planned and approached FIP. And I'm happy to share FIP agreed to give online vaccination training program to all our pharmacists, pharmacy teachers, pharmacy students, community pharmacists. Mostly tomorrow we are having the final meeting of this vaccination schedule. Mostly from December onwards, we'll start training. This training will be carried out by through IPA, all state branches and local branches with the help of various pharmacy colleges. This is going to be one of the major achievement of IPA. And medical devices, earlier medical devices are there, but till now, only because of COVID-19, we came to know what is oximeter. I am not telling the regulators knows all these things, but a average pharmacy man, they don't know. Now we came to know this is comes under medical device. So many medical devices. We were not trained. This is our area. We left our area and left it to IIT people, IIM people. If you take the patents received by IIT and IIM in last 2 years are more than 500 in medical devices. This is our area where we have to train our pharmacists on medical devices. This should be included in our curriculum also. That's what we are giving suggestion to the apex bodies. Telehealth, this is one of the wonderful area which proved a great success in the developed countries. When I heard one lecture from the US, most of the pharmacists were guiding the patients over phone and advising the patient not to come out and not to expose yourself to the COVID-19. They are for small ailments, they are treating and by with the use of telehealth in medication therapy management, critical medication review. And if the ailment is severe, they are advising the patient, okay, go to this hospital, go to this. That was the services. So online pharmacy. Now, not only in India, it has created a lot of disturbance among the profession. Even yesterday, I have seen a news in Amazon started the biggest online pharmacy in US, which is shaking the market of US also. This online pharmacy, they are going to just deliver the goods. But if you provide the value-added services, the patient will come to the pharmacy. That's what I want to advise our pharmacists to equip ourselves with the value-added services. And we have to prepare ourselves as a knowledgeable professional, develop core competency level, furnish with information, IT knowledge, be honest and be sincere. That's what I want to advise the students and the young pharmacists. Have a good communication skill and don't try for any shortcut because there is no shortcut for success. That is I want to say on this platform. Inculcate the habit of lifelong learning. This was lagging here. Learning is not compulsory, neither is survival, particularly for the profession of pharmacy, I want to say. Through this NPW and its theme, let us make use of this opportunity to communicate how pharmacists are transforming health through a variety of health services, including advising on healthy living, vaccination to prevent disease, medicines are taken correctly or not, and thereby managing disease and improving quality of life. This we have to promote during this NPW. That's what I want to request all the state branches and local branches. For every patient who walks in, we must ensure that right medicine is provided at right dose and in most suitable formulation with required information, which was lagging at present. So, with these few words and my the presentation, I want to thank all the IPA state branches, all the IPA local branches, and all the institutions, managements of various pharmacy colleges, principals of various pharmacy colleges, staff of the pharmacy colleges, and students for coming forward and organizing this NPW 2020 in big way throughout the country. On my behalf and on behalf of IPA, I thank all these sectors for coming forward and organizing this NPW in a big way. Thank you very much for giving me the opportunity. Thank you. Over to Kansal.
Yeah, thank you, Dr. TV Narayan. It's been a wonderful source of inspiration and information, basically. I think you have in-depth information from every facet of our profession. And you have given us a lot of advices that we really need to adhere to and take the profession of pharmacy to greater heights. So I think it's been a wonderful, informative lecture that you have given. I'm sure all are impressed, and I have received a lot of questions from many of my friends and the audience, which I have narrowed down. Probably one or two very important ones I will take up. Like you said that during this pandemic or prior to the pandemic, we were unknown figures. We were not at all known in the society.
Yeah.
But during the pandemic, at least now the common man knows that there is someone called a pharmacist in the entire healthcare chain.
Yeah.
But as a professional body, as the Indian Pharmaceutical Association, the apex pharmaceutical body, can we take up the cause that the pharmacists are recognized as frontline warriors in this period, and they get the benefits. Probably those who have, really got contracted with the virus, and those who lost their lives, and those who were actually affected for so many days because they were in the front line. So can we take up this cause with the government and tell them to actually recognize us in black and white that a pharmacist is the frontline warrior also among other professionals?
Yeah, it was already taken by, the issue was taken by IPA and advocacy group. Through advocacy group, we have represented this to the government.
Yeah.
And the 6 pharmacists who sacrificed their lives from the state of West Bengal were given all the benefits by the central government.
There's a lot of grievance from our community pharmacists that in each state or they are not being recognized, especially in Karnataka. Nothing of that sort has happened, even though many of our colleagues affected. Probably
the first step is being the people who worked in government sector, the pharmacists. We are able to succeed in that.
Great.
But now we can try all these community pharmacists also.
Community pharmacists, basically.
Once this vaccination program is successful, all our community pharmacists will be utilized for this vaccination. Then government automatically will know the services. Yes, pharmacists are highest number contributing to this noble cause. Like that, we have to give impact. That's what I am telling. We have to give our impact. And even from advocacy group, we can send it to the central ministry, health ministry again,
Yes.
to consider even the service of community pharmacists. We can take the help of AOCD also. That we
Yeah,
can-
sure. Yeah, definitely. Sir, another question from Dr. Sunil Chiplankar, who's another dynamic figure in our profession of pharmacy. So he's keen to know what the IPA is really doing in the field of Ayurvedic, nutraceuticals, and veterinary sciences. Yeah.
First of all, my congratulations to Sunil Chiplankar, who got prize in NPW competition. See, that I forgot, and during NPW, we have organized a competition to all the pharmacists, registered pharmacists and students and all, to come out with some innovative ideas, what the profession, how the profession can implement those ideas, what best we can project the role of pharmacist. And in that, he got the fourth prize, a national-wide competition. More than 3,000 entries are there. I congratulate him. And coming to your question of our involvement in Ayurveda, nutraceuticals, and other areas. See, why our failure is first. First of all, we have not proved ourselves in our area. First, let us prove ourselves in our area, then try to go to the other area. That's what I am telling. Earlier, our area is Ayurveda and Siddha. We left that. We have come to allopathy. Now, allopathy, we are coming with good industry facility and good manufacturing facility when compared with any other country. Let our pharmacists, because we were not trained, our pharmacists in Ayurveda and Siddha now. Already they have started with Ayush and all. They have their separate areas, they are coming out. Now, if we ask our pharmacists to go, it again dilute further. That's what I feel. Because the mistake what we have done is we have left our traditional system and started our allopathy, modern system. Even if you take Japan, China, Korea, Thailand, Malaysia, in addition, along with the regular allopathic system, they have the traditional system of medicines. Even I was shocked to see they are having this Ayurveda and their traditional system of medicine, even for cardiac disorders, even for neurological disorders. So we cannot do it now because already we left that profession. Again, it takes further 50 years. So first, let us prove here. Simultaneously, we have to develop because the syllabus is not covering now. Earlier, there was in the syllabus. We have completely deleted that syllabus. Again, the degree in Ayurveda has come. And the diversity has come already. Now we cannot go back to it. That's my feeling.
Yeah, if you permit me to add on to that,
Yeah,
I think we have also lost the front of nutraceuticals, because nutraceuticals actually has been our domain, and we have given it up to food safety and standards.
Medical devices.
All the formulations are standardized under the allopathic system, but the nutraceuticals have gone over to the food department. So basically, we need to really do some groundwork and try to appraise the policymakers and probably see that some efficient policies are really made up. So I think we can try to finish off the session. I now request Dr. B. Ramesh, Principal of Adi Chunchanagiri College of Pharmacy, to deliver the vote of thanks. Dr. Ramesh.
Thank you, Mr. Khan. I take this opportunity to express my profound thanks to Dr. T.V. Narayana for his wonderful informative session, which lasted for more than 1 hour, and we never felt its repetition of the other kind of webinars. I wholeheartedly, on behalf of all the IPA Karnataka State Branch office bearers, I congratulate him and I thank him in spite of his national and international engagements. He is kind enough to address the pharmacist and student community. That shows his commitment. And I also thank the chairman of Karnataka State Branch, President Dr. Premnath Shanai, Vice President Dr. Reddy, and the incoming Secretary, Mr. Khalid Khan, who was instrumental in organizing this the very event by Karnataka State Branch, and all the office bearers, the Manjunath, And I would like to extend my thanks to Mr. Sheshasai, who is a pharmacist and who has taken lots of pain in logistic arrangements of this webinar. I once again congratulate and thank all the members for their active participation. Let us build the pharmacy profession with whatever the capacity we are in our day-to-day activity. Thank you one and all.
Thank you very much. And thanks to all the participants from the community pharmacists area, from regulator side, from the industry side, from the teaching professions, everyone. Please take this thanks as a personal thanks for attending this particular webinar. Thank you so much.
Thank you.